Hello, viewers. Welcome to Visionary Walks at I Want Second Opinion. Today we have got our Dr. Sanjay Raina. Hi, Sanjay.
Hello, hi.
Hi. To all the viewers, Dr. Raina is a pediatrician. He is a consultant pediatrician with nearly 25 to 30 years of experience in the field. He has got special interest in pediatric cardiology and allergy. So today we are going to imbibe all his knowledge and extract all the information from him, and in the specific topic of cow's milk allergy, which is a very common problem in this particular part of the world. So let's start straight into it. Sanjay, are you happy to jump straight into the topic, please?
Yes. Thank you, Raj. Thank you for the introduction. So, cow's milk protein allergy is not only common in this country but worldwide. It is the
Okay.
common allergy in infancy in
Okay.
the UK and rest of the world. So,
Okay.
it may be IgE mediated and non-IgE mediated.
Okay.
But some people talk about lactose intolerance, but lactose intolerance is not immune mediated. This is
Okay.
immune mediated. So
Okay.
it can also be implicated in atopic eczema, gastroesophageal reflux disease, and chronic gastrointestinal symptoms.
Okay.
So consider this in a child whose
Yeah.
symptoms do not respond adequately to specific treatment.
Okay.
So when you are assessing these children, there are two types of allergies. One,
Okay.
I said, is IgE mediated allergy. The
Okay.
IgE mediated allergy is an immediate allergy.
Okay.
So,
So what exactly is IgE for the knowledge of the general
yeah,
public?
immunoglobulin E allergy is acute allergy. It is the allergy which happens in hay fever, or it is an allergy which happens in peanut allergy, and it can be very dangerous. So,
Okay.
so this allergy actually most of the time will come up as a skin rash, and
Okay.
can happen within 2 hours. And
2 hours of taking the milk, you mean?
after taking the milk, and after taking them within 2 hours. So
Okay.
children can come up with a rash, a skin rash, or can have gastrointestinal symptoms or
Okay.
respiratory symptoms.
Okay.
So with regards to skin, they can get itchy skin or blotchy skin. And
Okay.
some children can have gastrointestinal symptoms, which are vomiting, diarrhea, abdominal pain, and lip swelling. And some
Okay.
children can have stridor, which means the noisy breathing. When they are taking a breath in, it will be noisy, and
Okay.
they can also become wheezy. When they
Okay.
breathe out, there will be a whistling kind of noise on
Okay.
breathing out. So,
Okay.
and there have been reported deaths as well. Secondly, to anaphylaxis by cow's milk protein allergy, but this is
Okay.
very rare. This is very rare.
Okay.
So common symptoms are reflux, abdominal symptoms, vomiting, colicky abdominal pain, and sometimes you can even have blood in the stools.
Okay. Okay.
So then there is another type of allergy, which is non-IgE mediated allergy. See,
Okay.
the non-IgE mediated allergy is a T cell mediated allergy.
Okay.
So, in other words, this cannot be tested on the skin or blood test.
Okay.
Yeah.
Okay.
So the only way you can diagnose this is by taking the food element out. Say, for example, in the cow's milk protein allergy, you will take the cow's milk out of the diet.
Okay.
Okay. So this usually happens after 2 hours after ingestion of the milk, and
Okay.
can happen up to 24 to 48 hours after the
Okay.
exposure.
Okay.
In this, the main symptoms are diarrhea, blood mucus in the stools, blood or mucus in the stools, abdominal pain, colic, food refusal or aversion, and redness around the bottom.
Okay. So the respiratory symptoms won't be here.
No, they are
Okay.
mainly gut symptoms.
Okay.
And so the fact is that sometimes some children in this non-IG mediated allergy can have profuse diarrhea, extremely severe diarrhea and
Okay.
vomiting, and they can become very sick.
Okay.
They appear like they have a very severe infection,
Okay.
and sometimes needing intravenous antibiotics or intravenous fluids. So
Okay.
this is called food protein induced enterocolitis. Food
Okay.
protein induced enterocolitis. So in other words, both IgE and non-IgE mediated allergy can cause severe illness, but the severe illness is rare. The mild illness is much common, in
Okay.
which the child will have reflux. So reflux means when they drink the milk will come, a lot of milk will come out. Small amount of milk comes out in all babies, but when it is excessive and when it is associated with pain, which is suggestive of esophagitis, the lower end of the food pipe gets inflamed or
Okay.
gets sore. And when it
Okay.
gets sore, it causes a lot of pain, and children push their head backwards, extend their head backwards to ease the
Okay.
pain, to ease the
Okay.
pain.
Okay.
So it is like heartburn, but babies
Okay.
react differently.
All right.
So with regards to the that is the upper end of the gut. The middle
Sure.
of the gut, what
Mm.
happens is that we call it dysmotility
Mm.
because of the soreness of the lining of the small
Yeah.
intestine.
Yeah.
There is dysmotility, which means that the peristalsis, the way the food goes down or water goes down the small intestine, it loses that quality, and the air gets trapped within the
Okay.
small intestine. When the
Okay.
air gets trapped, it causes severe pain
Hey, colicky
and
pain.
colic pain, and the child, and this can happen during the day or night, and the child becomes very uncomfortable
Okay.
and can have screaming episodes, but it always gets better.
Okay. All right.
Then we go down to the lower gut. Lower gut is the large intestine.
Sure.
So same thing happens, dysmotility in the lower gut that can present as number one, that children will have loose stools, watery diarrhea, but
Okay.
they will still be pushing to get the stools out. There will
Okay.
be straining on the stools,
Okay.
and the lining in the lower bowel can cause mucus or blood in the stools.
Right.
Yeah. So if in infancy, in first few months of life, the first 3 months of life, if there is mucus or blood in the stools, the first diagnosis is allergy, milk allergy.
Wow. Okay. All right.
Okay. So we have covered the symptoms of upper gut, mid gut, and lower gut.
Yeah.
Now we can talk about what do we do with this
Sure.
in either situation.
Yeah.
So with regards to investigation
Mm.
for IgE mediated allergy,
Yeah.
there are tests, there are skin tests and blood tests. The
Okay.
skin test, in the skin test, we test the skin with control, that is normal water,
Okay.
and the milk protein.
Sure.
And if at the when we place little bit of milk on the skin,
Mm.
there is a wheal, there is a swelling
Okay.
of and it is bigger than the control,
Sure.
then we can say that the skin test is positive.
Okay.
The other thing we can do is to do a blood test, which is called a RAS test, antibody, to check the antibodies to the milk protein in the bloodstream.
Sure. It's
So
RAS. RAS. Is it RAST?
RAST.
Yeah.
Yeah, it can be sent to the laboratory and it will test for the milk allergy.
Okay.
So so that is how we test it. Now,
Okay.
in milk allergy, all the tests will not be positive, but
Sure.
that doesn't mean that there is no milk allergy. So then
Mm.
it is a non-IgE mediated allergy.
Sure.
So if it is non-IgE mediated or IgE mediated allergy, if the baby is breastfeeding,
Okay.
So we can ask mom to stop taking dairy, go on dairy-free diet. Yeah,
Okay.
yeah.
Okay.
But the cow's milk protein is still present in her bloodstream and in the
Sure.
milk
Yeah.
for 2 to 3 weeks. So
Okay.
we will also tell her that it will take up to 3 weeks for the symptoms to resolve.
Okay.
Okay.
Yeah.
So 10% of the patients with cow's milk protein allergy are also allergic to soya.
Oh, okay.
Yeah, yeah.
So there is,
So,
okay.
so we can ask mom, if the baby is not 100% better, to take the soya out of her diet as well.
Right. Okay.
Yeah.
Okay.
And same is the story with the non-IG mediated allergy.
Sure.
Now, what we sometimes do is that if the baby is bottle fed,
Yeah.
we can first go on to extensively hydrolyzed milk formula
Okay. Okay.
that is available in the market.
Okay.
So essentially what it means is that the milk protein is hydrolyzed, is broken down to small pieces.
Okay.
So the body's immune system does not recognize
Sure.
this milk protein.
Okay.
So, and we give a trial of extensively hydrolyzed milk for
Okay.
2 weeks.
Okay.
So if there is no response or there
Hmm.
is poor response,
Hmm.
then we go to amino acid formula.
Okay. Or
So
even more simple broken down product.
complete broken down. So
Yeah.
the protein is broken down to individual amino acids.
Okay.
Yeah. So both are available in the market.
Okay.
So in the cases where there is blood or mucus in the stools,
Hmm.
we go directly to the amino acid formula.
Sure. Okay. Lovely. That
Okay.
is
Should we progress further? So what is the history in the mid and long term
okay.
in these babies?
Yeah.
So most of these allergies resolve by one
Hmm.
year of age. I'm not saying
Okay.
all, but
Yeah.
most.
Okay.
So
Okay.
at 1 year of age, we ask the parents to go on what we call a milk ladder.
Milk ladder. Okay.
The milk ladder you can easily get from Google. So if you press Google milk ladder,
Yeah.
a ladder. So you introduce milk as different forms.
Okay.
I say there are stages where you go from cookie to muffin to pancake, small amounts,
Okay.
and then make your way to cheese, yogurt, and eventually milk.
All right. Okay.
So this takes up to 3 months to go
Right.
from, but you have to follow the guidance of the milk ladder
Sure.
on Google. Yeah.
Okay. Yeah.
And if you don't succeed, you go back to dairy free. Some
Okay.
children, most children will respond within 12 months, but
Okay.
some respond within 2 years.
Okay. Okay. So this cow's milk protein allergy, will it be manifesting right from the day one if the mom is taking milk protein as well? Of course, mom will be taking. Or
Yeah,
when
yeah.
does it start to manifest?
This is an interesting point. So they what there is a lot of literature on this. What
Okay.
uh, people are saying that it is the bowel lining is sensitive, and these children start having hiccups antenatally before they are born. So
Oh,
ask the mom whether this child has been hiccuping antenatally.
how
And
do we know?
sorry,
Before they are born, how will the mom know?
mom will know everything. Mom knows, they give the history that baby is hiccuping a lot.
Really?
Yeah, yeah,
Okay.
antenatal
Okay.
hiccups.
Hmm.
So the bottom line is that, and then there is history of milk allergy or irritable bowel syndrome in the parents or grandparents.
Okay. All right. Okay.
So the fact is that most children will not really present at birth.
Okay.
Most children will present within few weeks of birth,
Okay.
and some children will present earlier within first week or first couple of weeks. after birth.
Okay. All right. Okay. That's pretty interesting, actually. Now, what is the difference between cow's milk protein allergy and lactose intolerance? Are these two different entities, and how do you
Yeah,
differentiate?
they are two different entities. So
Mhm.
the lactose intolerance means that there is deficiency of an enzyme called lactase, which
Okay.
breaks down a sugar of the milk in the milk.
Okay.
So it is not an allergy, immune mediated reaction. It is not a,
Okay.
you cannot call it allergy.
Okay.
So
It's
it is just
intolerant.
deficiency of enzyme. So
Okay.
why will there be a deficiency of the enzyme? So
Mm.
sometimes what happens is that when we have diarrhea or loose stools or gastroenteritis,
Yeah.
the lining of the bowel is
Mm.
eroded.
Okay.
As a result of that, there is deficiency of the enzyme lactase. So
Okay.
we tell we tell parents that look, for next couple of weeks avoid milk in the children.
Oh,
this,
right.
this is called secondary lactose intolerance. But
Okay.
there is there is also something called primary lactose intolerance deficiency, where the
Mm.
child genetically is
Born with a genetic
lactose
disease. Uh,
lactase deficient.
okay. Okay.
So
So, yeah.
yeah, so but that is very rare.
Right. Okay. All right. Okay. So, what symptoms do this lactose intolerance people present? And lactose intolerance can present at any age. Even adults will be a.
Absolutely, absolutely, absolutely. They will have diarrhea, loose stools, bit of tummy, abdominal discomfort. But
Mm.
the cow's milk protein allergy is different, that it can affect whole gut from the mouth to the large gut. Whole of the
Oh,
lining of the bowel
okay.
is affected or
Okay.
can be affected.
All right. Okay.
Unlike lactose intolerance will cause really problem in the lower gut.
In the low. Okay. All right.
Yeah.
Okay. Okay. And so, if a kid has got milk protein allergy, and what are the long-term implications or complications if the cow's milk allergy problem is not very well managed in a kid? What will happen?
There is no long-term uh, effects.
Okay.
So they will not develop into any inflammatory bowel condition or any long-term problems. So
Okay.
in other words, we say that it is more of a nuisance than a
Ah,
problem.
okay.
Yeah. But if the children are on dairy free for a long period of time,
Hmm.
for dairy, one has to be very careful uh,
Okay.
while reintroducing the milk. They may have a severe reaction as compared to what they had when they were an infant.
Sure. All right. Okay. Now, what is the incidence of this cow's milk protein allergy in the population, in the pediatric population?
So in the pediatric population, it is thought to be 1% of the
Oh,
population.
that okay.
Yes,
That common, in fact.
it is very
And
common.
okay.
It is
And you
it
told
is
that
very
majority of the symptoms comes down by 1 year of age. What
yes,
percentage of people continue to have this cow's milk allergy problems lifelong?
less than 5%.
Less than 5% of the 1% population.
Absolutely, yeah, yeah. And usually happens is that those who do not tolerate the
Mm,
go on do not tolerate the milk,
mm,
they uh, some of them
mm.
will tolerate small amount of milk, but not um, not a large quantity of milk. In other
Sure.
words, there is a point beyond which they will start having symptoms like diarrhea, loose stools, or like discomfort, tummy ache. If
Sure.
they, for example, they may be able to have 1 glass of milk, but not 2 glasses of milk. Or
Oh,
yeah,
okay.
and some children will be able to take like cookies or chocolates, but not have fresh milk, or even yogurt, but not
Mm,
have fresh milk. Yeah.
right. Okay. That's quite interesting. And in the adult age group, who the 5% of the 1% population, what symptoms will be there? Will they be developing? Will they having respiratory symptoms, or will they be having abdominal symptoms? What problems do they continue to have?
No, the adult, those who don't grow out of their milk allergy, they make a choice. They will not have milk, or they will be very careful with milk.
So they would have learned about it by personal experience. They would avoid it as much as.
Absolutely, a lot of people don't know they have milk allergy, but they will not take milk. And they will say only I can have little bit of milk in my tea. And they beyond that they will say no, I will not take a lot of milk, but they will make their choice.
Right. Okay. By personal experience, past lifetime experiences. Okay. Fantastic. Okay. So, are there any myths or anything that is associated with the cow's milk allergy that needs to be erased off from the community's perspective? That you remember? How do people?
I didn't get the question. Say it again.
A lot of people will come to the clinic and they will be associating something else with something else. There will be having some myths about any problem, and every problem that will be based on community. Are there any such kind of myths that are associated with cow's milk allergy, or no, it is not?
No, look, generally what we have seen in the last 20 years, this has exponentially grown. The awareness, one. Number two, the awareness of it. Number two, the problems and that the parents are seeking because the child doesn't sleep at night. Or sleeps. It has become much more prevalent, much more known. And sorry, say it again. What is the real question you wanted to ask?
No, that's fine. No, I was asking whether there are any myths associated, but you told that there is nothing there. Okay.
Myths. No, the myth, sorry. The myth is that what people are saying, that because it is growing exponentially in the world, that because the children are not getting normal infections, normal cold, runny nose, and they are not exposed to what is called dirt. The immune system is not busy dealing with all those things, because that the allergies, the autoimmune diseases, and all these things like asthma, eczema, diabetes is worsening, particularly in the developed world.
All right. Okay. Right. Okay. I can understand that. Okay. Sanjay, thanks a lot. You covered this topic really fantastic. Is there anything else that we have missed in our conversation that you would want to pass it on to our viewers who would benefit from your wisdom?
I think we can close it here. But if there are any questions, I'll be happy to take them.
Fantastic. Sanjay, I really appreciate for you to come over. I look forward for seeing you in many more topics to come where you can educate the public with your wisdom and your learned experience. Thanks a lot, Sanjay. I appreciate it, man.
Thank you, Raj.
Cheers.
Cheers. Bye-bye. Bye.